Hello, everyone. Welcome to our first webinar of 2025. Um, Very happy to have Dr. Holly Ganz, co-founder and chief science officer of AnimalBiome. I'm going to start a presentation here briefly before we get started, so you have something to look at, and we can come back and see everybody. Can you see my screen? All right. Um, yeah, welcome, Holly. Today we're going to listen to Dr. Holly Ganz talk about the secret to a happy and healthy pet and understanding gut health in dogs and cats. A little bit about BirchBark, who's hosting this webinar. My name is Jacob Wilkins, and I am the executive director. And our vision at BirchBark is really simple: that no financial hardship should really never be the cause of any loss of pet or a loss of pet life for a family. And we're a 100% donation based 501c3 organization that's focused on honoring and protecting the human animal bond that's so important to all of us. We have three primary programs that we support. Our pet aid is one that we're probably most well known for, but we also where we provide that financial assistance to vulnerable families faced with unaffordable medical expenses. But we also support folks that don't need medical attention by way of grief support and counseling. That's support for all families, whether or not they have financial troubles with pet loss counseling programs. And tonight we're going to take part in the third pillar, and that is our learning and education program. And I'm going to hand this off to Dr. Marianne Birch, our founder and board president for the last several years. And Marianne, if you'd like to talk a little bit more about tonight's presentation, that would be wonderful.
Yeah, and these beautiful pictures of animals that were saved with our resources through Pet Aid. Thanks everyone for joining. And I think Jacob did a great job of talking about kind of the three pillars of our focus at BirchBark. And number one is that we are financially supporting families, low-income families who can't afford a life-compromising uh, medical issue, and that we work with the veterinarians who discount the bill. We ask the owners to come up with a percentage, and BirchBark will pay up to 50% to help save the lives of those pets. But also part of my goal when starting the organization was to be an advocate for pets, whether it's financial need, the emotional part of decision making around saying goodbye to your pet, and then also making sure that we could be advocates for our pets. And a big part of that is knowing about how the science is going there, being basically emboldened or have the courage to ask all the questions of your veterinarian when you're facing medical decisions for your pets. And so the education webinars are really to help educate pet owners out there about what's available and how they can be advocates for their pets. So, Jake, I didn't know if you had a few more slides to share, or are we all set with our pre?
I
Uh,
think I think that we're all set with our pre. I had
okay,
one that was just about education and awareness, but we did a pretty good job. So
okay, and
take it
I
away.
covered that with words there. So tonight is actually one of my favorite subjects, and being an internal medicine specialist who's done GI disease for 30 plus years. And when I graduated vet school and finished my residency, it was, kind of do endoscopy, look at the microscopic biopsies, and then choose a therapy. And knowing that the body is such a dynamic structure, and that we cohabitate with a lot of other creatures in our body, it's been fun for me to evolve in recognizing, and in some particularly good cases that have taught me a lot, that being symbiotic with what's in our guts is a big part of controlling intestinal disease. And so Dr. Holly Gans, who took this to a hey, and you can tell your story, but I believe it was a personal experience with her pet that motivated it. but she started an organization that I have really enjoyed working with called AnimalBiome, and you're going to hear all about that tonight. And I have to say her CV is remarkable. She's got a bachelor's at the George Washington University, her master's at Scripps, postdoc work at Davis. Sorry.
Oh, did my PhD at Davis and then postdoc at Berkeley, and then I went back to Davis, so it's confusing.
And Switzerland. And so a lot of postdoc work. So just really a curious person, which I admire and love. So also a little housekeeping, if you have questions during the lecture, you can put them in the Q&A, and we will make sure we try to get to them at the end of the presentation, do our best to answer those questions. So without further ado, Dr. Holly Ganz, welcome.
Thank you, Marianne. So nice to be here. So let's see, how do I, slideshow mode. Can you see my slides?
Yes.
Okay, awesome. So I'm really, really honored to be here today to talk to you about the secrets that I've learned about how to have a happy and healthy pet, and through understanding gut health in dogs and cats. And I'm also happy to learn about the second pillar with BirchBark, because here's my dog Charlie, who we recently had to say goodbye to, but he had a very long and happy life and made it to at least 17 years old. And he had a perfect gut up until the end. So it was cancer that got him, but it wasn't his gut. And I could use some grief counseling, but we'll save that for later. Sorry, I'm trying to advance. So just to give you an outline of what I'm going to talk about tonight. First, I'm going to start off with talking about the gut microbiome, what it is and why it is vital to your pet's health. Talk about some science associated with imbalances in the gut, like digestive issues, skin problems, and even behavioral issues. Briefly talk about nutrition, probiotics, and other biotics that can support gut health. And for fun, I thought I'd have a section where we talk about some common myths and misconceptions about gut health that are very widespread. And then offer some tips for pet parents like us for how to support and improve and maintain gut health. So first, what is the gut microbiome? And I can't ask you questions, so because I can't see everyone, but I'll just I like to sometimes be interactive here. But so the gut microbiome is a community of microorganisms, and they estimate that in humans it's something like 100 trillion different microbes. And I thought this cartoon was funny. So it is a living community that lives in or on us and our pets. And you can sort of view us as like we're surrounded by a cloud of microbes, and they are on and in us. And so what organisms make up a microbiome? Is it bacteria, viruses, fungi, or all of the above? And it is all of the above. And just know that the viruses are mostly viruses that, well, pretty much entirely viruses that affect bacteria, and not your cat or dog or you. So where do most of the bacteria that live in a cat or dog reside? And I wish I could see your answers, but mostly it's in the large intestine. And what percentage of bacteria and fungi make up of the cells in the body are made up by bacteria and fungi? So is it 70% or more, 50%, 30%, or less than 10%? We used to say it was 90%. But then they did a study where they actually counted all the cells, and if you include all the blood cells in the body, which are a lot, then it's more like 70%, maybe even like it's above 70, but it's not, maybe not 90%. And as I already mentioned, they think that there are about 100 trillion bacterial cells in humans. It's a little bit less in cats and dogs, because they're a little bit more, their transit time of the gut is faster, and so just less time for things to accumulate and multiply. But it's probably similar, a little more in dogs than cats. So how does a balanced gut microbiome benefit health? Digestion and nutrient absorption, immune system development, training and regulation, brain function, or all of the above. This is kind of a gimme. So basically, there are studies that have shown a connection between gut health and all the body systems. So in addition to maintaining healthy digestion and poop consistency, it is important for maintaining a healthy skin and coat. Training, well, not just training, but also like the immune system is really critical. So half of the immune cells in the body are in the gut. So you can imagine that, as we eat food and drink water, that is a way in which invading pathogens can come in, and our body has to be ready to defend against that kind of invasion. Right, metabolism, like how does the body process food, and so the GI, the gut microbiome is really important for metabolic support and healthy weight. It's associated with longevity, heart health, and brain function. And oh yeah, this is sort of bigger, just showing you that same slide in larger. So which of the following do you think are most disruptive to the gut microbiome? Is it having a diet that's high in carbs? Like there's been studies, like microbiome studies, thinking about like if we, eat lots of French fries and hamburgers and buns, what happens? Antibiotics, right? They've been designed to kill harmful bacteria, but what about the gut microbiome? NSAIDs, or like anti-inflammatory pain relievers, and that are non-steroidal. And then, parasites and pathogens. These are all things that could be disruptive. And when we think about which are the most disruptive, it's probably antibiotics, because they are really specifically killing off bacteria. But the microbiome is also very responsive to diet. And there are some really interesting studies where people like did the McDonald's diet or whatever, and their microbiomes like look terrible. And they've done like really interesting nutritional studies showing that like if you even like feed mice like a high carbohydrate diet, and they're sort of meant to be eating more carbs than we are, their gut lining becomes inflamed, and you start to see more leakage of materials coming from the gut into the body in a way that's not normal. So they call that like an impaired gut barrier function. And it's also associated with a reduction in the diversity or the different kinds of bacteria that live in the gut microbiome. And I sometimes like to start with talking about thinking about like this community can be viewed as like an ecosystem inside our bodies. And so it's important to support it. So what are some signs of imbalances in the gut microbiome? So the sort of obvious things that are pretty common are like vomiting and diarrhea. So sort of the ins and the outs of the system. And what is more surprising is that like skin problems can be associated with this. That gut health can lead, inflammation in the gut can actually lead to red, painful skin. And that was not sort of obvious before people started to look at this. It can be associated with a compromised immune system. The immune system doesn't know what to respond to appropriately. It starts to responding to normal components of food. If a microbiome is out of balance, you can have unexplained weight loss and inability to extract nutrients from food, or the opposite, where obesity or a pet can become overweight. And then sort of chronic inflammation, heart disease, and then stress and anxiety are sort of, these are the flip sides of having when the microbiome is not working right. So yeah, I want to touch briefly on the topics of nutrition and the prebiotics, probiotics, postbiotics, and gut health, starting with diet and then these biotics and what are they. So we did do a study where we talked to over 2,000 pet parents last year. And we asked them some questions to try and understand what they were aware of in terms of all this microbiome stuff and pre and pro and postbiotics and all this. So diet is critically important for gut health. We really are what we eat. And that's true for our pets. It can be a bit easier to regulate what they eat than it can be for ourselves. So diet is a leading influence on gut health and our overall health. And if you feed good food, you will feed good organisms in the gut. And when we talked to people last year, we found that 1 in 3 people were surprised to learn that diet had a connection with gut bacteria, because it's probably not something we learned about in school. But these bacteria are interacting with our food that we take in, right? And they're helping to break it down. We also asked people what kinds of foods were they feeding their cat or dogs, and found that 1 in 4 dogs were fed exclusively a dry kibble, and 1 in 5 cats. And then we asked them a bit about, like, well, what kinds of foods do you feed? We found that of the people that we talked to, about a third of them were feeding a diet that had some raw food in it. So raw food is food that it can be dried, freeze-dried, or it can be fresh, but it is not cooked or extruded. And only a small percentage, 1.3% of the dogs and about 0.5% of the cats were fed exclusively a raw food. There were a large number of cats and dogs had some homemade food included in their diet, ranging from about 30% in cats to 40% of dogs. And a much smaller percentage, but more than the raw, cats and dogs were exclusively fed homemade food. But there has been a big shift towards more of these fresh diets in general over the last decade or so. So what about diet is important? Well, a great place to start is sort of what we call the macronutrients. So that's like protein, fiber, carbohydrates. And so I'll start with protein. Protein is essential for cats and dogs. I mean, it's essential for us too. And it is broken down into important molecules that are critical for helping the good bacteria that live in the gut perform the functions that they need to perform. It is an important source of energy as well for gut bacteria. And it helps to support having a nice diversity or many different kinds of bacteria in the gut, which is associated with having a healthy community. And in cats and dogs, protein is even more important for them than it is for us. Cats, even more so than dogs, as they are obligate carnivores. Thinking about fiber, so dietary fiber is really important. It helps to maintain healthy stool consistency, or right, like how soft or firm it is, and also how frequently your cat or dog poops. And the fiber also feeds the good gut bacteria. These bacteria then break down the fiber in a process that's called fermentation. There are different kinds of fibers, so food ends up being really complicated. So there's some fibers that are like really fast fermenting, some are medium fermenting, some are slow fermenting, and then there's also like bulky fibers, which is more important in people than in cats and dogs. So when bacteria break down these fibers, they produce molecules that help to support a healthy function of the immune system. And some of these molecules are really important in being potent anti-inflammatory compounds and combating inflammation in the gut. And there are a number of studies showing that diets that are high in fiber are associated with lower rates of cancer and heart disease. And while maybe cats shouldn't have a high fiber diet, they do need to have some fiber in their diet. So even raw fed animals do benefit from having a small amount of fiber included. And that fiber is really to feed these gut bacteria that are so critical in supporting health. So carbohydrates. So long-term feeding of diets that are high in more simple carbohydrates, like especially those found in treats, and sort of lower quality diets that are maybe more budget, can result in poor gut health. But you can supplement these with some good fibers. Too many carbohydrates can cause imbalances in the gut microbiome, and some of them promote this excess inflammation throughout the body that I mentioned earlier. We did a study with over 60,000 samples looking at from cats and dogs, and these pets had their owners or their pet parents reported detailed information about their diet and health. And what we found was that the cats and dogs who were fed diets that had too many carbohydrates tended to have a lower diversity of gut bacteria, and they were more likely to have a harmful overgrowth of certain kinds of bacteria like E. coli that we think of as sort of a frenemy. They should be there, but they should be in low levels. And if things get out of balance, then they can kind of flare up and cause problems. So this is just an example so we offer microbiome testing as one way to try and gain insights into what's happening inside your pet. And this is one of the groups of bacteria that we look at. It's Megamonas. There's a few different species in there, and it's a group that does respond to increases in fiber. And so you want to have the right amount of Megamonas. Like, it's nice to have some, but you don't want to have it be completely overgrown with it. They are really important for supporting healthy metabolism. But if they become sort of overgrown, then they are associated with malabsorption of nutrients. And there are sort of various reasons for why that could be. And one thing I like to think about them is that when you sort of go on a weight loss diet, they tend to come up because they actually are better at sort of extracting nutrients and calories from food. So if and that's sort of part of actually why you stop losing weight with some diets. And so it's good to take a break and then try again and sort of vary things, sort of interval training for the gut. So the concept here is that even beneficial bacteria can be harmful when their levels become too high or overgrown. And if you have a diet that has diverse sources of these macronutrients, you can reduce the risk of one group sort of taking over. So Clostridium is another group that has some really great member species, and then has some other species that might be a little bit more of a frenemy. So there are over 150 different kinds of Clostridiums, and many of them are really important and beneficial for cats and dogs, and are associated with like protein digestion. One group that's really important, it was in the Clostridium, but now it's called Peptidobacter hieronymus, and it's really important for bile acid metabolism, which is something that needs to happen in the gut. And if it doesn't happen, then actually it changes the whole microbiome, and it's associated with certain diseases that may develop. So that's they consider hieronymus like a keystone species. It's really important for gut health. Other Clostridials, other members of this order, the Clostridium group, like C. perfringens, are commonly found in cats and dogs, and they are normal, but some of them can actually produce toxins. And so you want to keep them at the right levels and not let them become overgrown as well. So C. perfringens is a little bit more of that frenemy group. So the idea here is that there are different kinds of bacteria, and there are many different ones. And even the same group can have close relatives that are both beneficial and harmful. Oh, and I wanted to sort of add that, if I can go back, I don't know if I can go back. And you can manipulate them by making changes to the macronutrients. So if you want to increase some of these groups, adding in that are related to Clostridium, you increase protein in the diet, they should go up. Whereas if you increase fiber and carbohydrates in the diet, and you can do this by adding toppers to the food, you don't have to change the food, but you can if you want to. Anyway, you can change the relative amount of these bacteria by making small changes to the macronutrients in the diet. And then another group is Ruminococcus, which is responsive to decreasing carbohydrates and increasing fiber. And it's also an important core species in cats and dogs. But if one group, sort of the Ruminococcus navis, grows up and becomes overrepresented, it is associated with some allergic responses. So balance is sort of the key with the microbiome. So, and the concept here is that just because one bacterium is beneficial for one type of animal doesn't mean it will be beneficial in another. And that's why you need to have the supplements that you give your cat or dog be designed specifically for them. And then finally, fusobacterium is what I consider like the Goldilocks group. It is really important for digesting animal protein. And they found that in dogs with IBD that they had tended to have really low levels of fusobacterium. But if it becomes overgrown, it can also trigger diarrhea. So it kind of needs to be right in the middle. And this is a group that you can decrease with additional carbohydrates and increase actually with more, adding more protein. So I briefly wanted to talk about and pro and postbiotics. And I think it's terrible that scientists came up with these names for them, but what are they? So prebiotics, this is the way I think about it. And so I made this little graphic because I'm a child of the 80s and I love Ms. Pac-Man. So prebiotics are the fibers that beneficial bacteria or other microbes like to eat. The probiotics are actually the living microorganisms that are put into supplements and have been shown to have health benefits. And then the postbiotics are the different chemicals that the microbes produce after they digest the prebiotic food that they take in. And then just showing some postbiotic compounds produced by gut bacteria. We have acetic acid, propionic acid, and butyric acid, which are short chain fatty acids. And then serotonin, which might be one that you wouldn't have thought is produced by bacteria as opposed to being produced by the host. So we did ask people, what did they think about prebiotics and probiotics, and did they know the difference? And I'd say that most of us don't. So like 44% did know the difference, but these terms are very confusing. But even though we're not totally sure what the difference is between them, about 45% of dog parents and a similar number of cat parents had bought probiotics in the last year. And then an interesting trend is that about a third of dog diets, based on our survey, had both of these prebiotics and probiotics in them. And that's sort of been a shift. Usually diets have prebiotic fibers in them because that's important, but adding probiotics is kind of new because they usually don't survive manufacturing. So I think I'm going on a little long, so I'm going to sort of race on through some common myths and misconceptions about the gut microbiome, and just sort of say myth or fact, there are only good bacteria in the gut microbiome, and say actually it's not true. There are some bacteria that live in the gut that are more like a frenemy. We call them a pathobiont, and they need to be kept in check by other bacteria that live in the ecosystem. Every pet has a gut microbiome that's completely unique. Is this a myth or fact? In this case, it's true. We're all unique. And in fact, the FBI is using microbiome as one way to try and identify people. And some of the factors that affect the composition of the gut microbiome are like how we're born, if we're born by C-section or vaginally, the environment that we live in, how old we are, sex, genetics, nutrition, and exposure to antimicrobials. All of these things can affect the composition of the gut microbiome. Myth or fact, the microbiome is so individualized that 2 dogs wouldn't be expected to share that many microbes or gut bacteria. And actually, we've done a lot of work on this. And while it's true that we are each unique, we do share a lot as well. I mean, at least 2 dogs would share some important bacteria. So we've thought a lot about this concept of like the core microbiome, and is there a community of bacteria that are associated with health in dogs and a different one associated with health in cats? And we found that there are more than 26 different kinds of bacteria that are found across healthy dogs. And this is probably too much detail, but then we sort of looked at, there's some overlap between cats and dogs, but there's, more than 26 different kinds of core bacteria in dogs, and then there are more than 22 in cats. And there are some groups that are shared, although they may differ when we sort of look at a strain or deeper level. So dogs from across the US can't possibly have the same bacteria in their gut microbiome. That's been one question that we've gotten. And what we found, we looked at different regions of the country, comparing Northeast, the Midwest, the South, and the West, and found that basically healthy dogs do share most core bacteria. We did find a small difference in the West, which I think might have reflected that we have more of a raw feeding community here. So I wanted to have a few moments to touch on some advice for improving and maintaining your pet's gut health. So as I've mentioned, the gut microbiome is an important modulator of host health. It helps to maintain healthy poop consistency, as well as frequency of pooping, helps to support healthy skin and healthy immune system function. It also, actually, there's a microbiome in the oral cavity that's really important, and that a healthy oral microbiome supports oral health and helps to prevent pathogens from invading there. And it helps maintain a healthy GI function, which has, as I've mentioned, many different facets. So one thing that we've realized in some of our research is that the beneficial bacteria that live in the gut can decline with age. And I mentioned earlier that there's this group, which we'll just call Hieronymus, and it's an important keystone species in the gut. It plays some critical roles, and there aren't other bacteria that live in the gut that are able to do that. And so this group actually decreases significantly with age. And we asked the 2,000 people that we queried last year what they thought about how the microbiome might change with age. About like 40% thought that the microbiome may become more diverse, 12% thought that it stayed the same, and 45% thought it became less diverse. And to be fair, they probably hadn't thought about the microbiome before, so they could go either way, 50-50 guess. So the microbiome diversity actually does decrease with age. But there are some proactive ways that you can care for the microbiome in older pets and even middle-aged pets, or even young animals. So one is that I definitely recommend working with a veterinarian on their diet to ensure that the diet that you choose supports the right balance of gut bacteria, and especially for seniors, but actually I think starting early, setting them up for a healthy life is just really important to invest in a good diet. And there's a range of ways to do that. And some people are even, cooking themselves, although not everyone has time for that. A second thing that I think is really important, we've done a lot of work on how medications, especially antibiotics, can alter the gut and affect key groups of beneficial bacteria. And so when your veterinarian recommends antibiotics, it's probably important. But I would just urge you to ask them if it's necessary, because sometimes they're given prophylactically. For example, my dog had a foxtail, in his paw that had to be removed, and they had to kind of dig it out. And so they were worried that he would get an infection, and they wanted to give him oral antibiotics. But I asked them instead if I could wash this and soak the paw instead, and then wait and see about giving the systemic antibiotics. And we were able to avoid having his gut microbiome be harmed as a result of that. But I just want to say antibiotics are life-saving. I'm not trying to get into the people's practice of medicine. Just sometimes they can be overprescribed. Another example is, which people have told us a lot about, is like dogs and cats with diarrhea. Sometimes they are given antibiotics as a way of controlling like a clostridial overgrowth. And while they can help with that, it turns out that the relapse rate is between like 90 and 100% with that approach. So they end up on this like medical merry-go-round where then their animal keeps getting exposed to things like metronidazole, which then keeps causing harm to the gut microbiome. And then they end up basically living with a chronic GI condition because of it. One way you can try and understand what's going on in your pet's gut is to do microbiome testing, and that's something that we make available. And then you can sort of look and see on an annual basis how they're doing. And this was something that made a big difference for me with my dogs. And then finally, this is the really edgy thing, which is you can consider doing something like a fecal microbiota transplant, or FMT. That's really right now the only way to restore these key groups of bacteria after antibiotic exposure. And they can be given at home in capsules or as a procedure at your veterinarian's hospital. So when you look at the composition of gut bacteria, these are some of the things that we found. So we sometimes find the wrong proportions. Like, so the key groups of good gut bacteria are present in the sample and in like your dog sample, but they're sort of they're just in the wrong proportion. And that's something that can be addressed pretty well with dietary interventions, unless there's some like underlying thing pushing it in the wrong direction. If they're missing common important gut bacteria, that's when sort of FMT becomes implicated, because probiotics on the market today don't have those bacteria in them, though we're working on creating those, but they are in things like the FMT. And then the other thing we found is that harmful bacteria can be above the threshold. Like, so things like E. coli, actually E. coli live in all of us. They are normal, but they should be at really low amounts. And when they get overgrown, they promote inflammation and are problematic. And so, yeah, when we've looked at samples, we sort of find that a lot of pets are missing common gut bacteria, and in many cases, it's because they have had exposure to things like antibiotics. About 26% have had harmful levels of these frenemies that I mentioned earlier that are just overgrown. And then 34% have they have the good stuff, but they need a little more fiber. That's a common thing we find if they're sometimes on a high protein diet. People don't always think that their pet needs fiber, but we're all different. We all have different gut bacteria, and some of us need a little more fiber than others, and some of us need a little more protein than others. And it's just that's why it's useful to try and look at this. So we asked people how often their pet experienced common symptoms to a microbiome imbalance, and the scale was from like never to always. And we were sort of disappointed to learn that in this survey of 2,000 people, 35% of the dogs were reported to always or often have a skin or GI issue, and about 25% of cats. And so this is too many pets are living with these kinds of chronic digestive and skin conditions. And I really believe that understanding and restoring the gut microbiome can help to eliminate this. So this is kind of a fun thing that I usually get a reaction out of people. So I'd love to see the follow on here. So how many people think that healthy cats, and this is healthy, not the ones with the chronic skin or GI condition, healthy cats or dogs should take probiotics or these postbiotics every day? And so this is sort of surprising to people, which is that if you are feeding a good diet and you have a healthy cat or dog, they shouldn't need to take probiotics or postbiotics. But if they have a condition, then I think these are useful tools to try and help support gut health. And some of these insights came from the survey that I mentioned that we did last year of 2,000 pet parents. It's called State of the Gut 2024. And we created a really beautiful PDF that you can download. And I made a QR code for that to make it easy, because as you can see, the link that we have for that page is too much to type in. So, and I think we can provide that to people later, I'm hoping. And then I think actually I managed to not take up too much time, and I hopefully will have some time for questions. And should I stop sharing, everybody?
I think there is a BirchBark slide we're going to share, but certainly let us know through the Q&A if anyone wants to see the QR code to the state of the biome again.
Oh, maybe I can put the link in there. What do you think?
Oh, sure. Oh, yeah. If you put it in the chat or the Q&A, that'd be great. And we got some really good questions during your presentation. So I thought the first one is kind of you and me joint answering. And it's somebody who said, you know, they've had a lot of cats with inflammatory bowel disease and lymphoma and chronic GI stuff. And how common is that? And your statistics there said, you know, something like 25% of cat owners say that there's some chronic GI or skin issues. And I'll go out on a limb as an internist. I do think one of the things that we see is a lot of because we're doing so much better at rescuing pets from shelters, but we have no idea how they started their life, you know, in a barn somewhere, and whether they were found one day old without a mom, and what happened to their colostrum, how were their guts populated, did they have viruses, exposure to pathogenic viruses, parvovirus in dogs, well, and parvovirus in cats. I guess that's what panleukopenia is. So could they have played a role in how the microbiome was established, and then kind of like, you know, starting with a little bit of a microbiotic handicap, if you will, as a kitten. So I think that is one of the reasons, you know, a lot of the cats that I see have some type of dubious beginning, and good for us for rescuing them. And, you know, there's a whole issue of pet overpopulation. But I think that that's my theory as to why that is. And I don't know if you have a perspective that you want to bring on for why cats have a high incidence of inflammatory bowel disease. If you have any input there, Dr. Ganz.
Yeah, I mean, I'd love to see more work on this. I mean, I know people have written grants that they struggle to get this link between, right, IBD or these chronic enteropathies and like GI lymphoma is really, I mean, like, this problem is prevalent in cats, and if it doesn't get addressed, right, then it can really develop into lymphoma, which is really sad. Why is it? I mean, some people have thought that, is it because the diets that they're being fed are not high enough in protein, and that they, you know, as obligate carnivores should be fed a better diet? And there is the raw feeding community where they report they see improvements in some of these cats. I agree that with the parasites, they can cause a big change in the composition of bacteria in the gut, and are really important. And then and cats tend to get exposed to a lot of things like Cryptosporidium. We see feline coronavirus is very common. So I think it's sort of tricky to understand why it's so prevalent in cats, and I don't really have the answer. I just know that we should work on it and try and figure that out.
Yeah, and I think another thing is, you know, we talk about what's the cat's natural environment, and a lot of what we're trying to do in the industry is talk about enrichment environments for indoor-only cats, the catios, playing, all these things that potentially could affect all the other psychological and emotional benefits from, you know, how much distress everyone who's gone through finals know what stress can do to your GI tract. So, um, so that is another perspective that could play a role. There's a lot of variables for
I
sure.
used to do some work on cheetahs, and of course they struggle in captivity a lot, right? They're runners, and the veterinarian I was working with on that project was really a big advocate for a whole carcass nutrition for cats, and that if like there's tended to be, this is in Southern Africa, like some of the facilities that had a captive cheetah would just feed them like muscle meat. And then there were like, they would get gastritis or all these problems that would get resolved with nutrition.
Interesting. Yeah, and that's a good lead into one of the other questions where somebody said, define good food, which is a very difficult question. But when you're talking about good diets or good food, what would be your answer to that for people who are striving for that for their pets?
Yeah, I mean, it's right. The challenge, right, with nutrition is there's like so many different opinions, and we don't have like longitudinal studies to say definitively like this one will improve like the health span and lifespan of your pet. We don't have those data. So we have more short-term data, and we have people are very passionate, and it's sort of political because we don't have maybe all the data that we need to give definitive answers. But I think I tend to view it as like, I think it's worth, if you can afford it, to invest in a high quality diet. And that means that it has good sources of the ingredients, and that they actually are usually, the ingredients include foods that you recognize, as opposed to a lot of chemicals that you might not. I think I do think that this fresh food trend is really great. And I know that not everybody can afford to do that, but I think it's good that, for a lot of people, they're like, I don't know, for me, like my pets are my children, and like, I just would rather spend money on them than other things. But there are plenty of good, I mean, like I think there are really good quality kibbles. I'm not going to sort of like say don't feed kibble. Like there are definitely people who say that. I have fed kibble, I've fed raw, I have fed home cooked, and I've fed fresh food. I think the main thing is making sure that it has the right balance of macronutrients, and that's sort of what I tend to focus on. And we don't even know yet if like some of the responses that we see in gut bacteria to like raw versus kibble versus fresh, if it's because of the format of the food or if it's because of the macronutrients of the food, because it turns out like it's not easy to, you can't like make a food and then like put it in these different formats and test it, because the process of cooking it changes it. Anyway, it's so complicated. I don't have a good answer.
Well, and that is, and I have a lot of people over these webinars over the years say, what's the best food for my dog or cat? And, I have the uncomfortable answer of whatever makes them feel the best, which I know is a cop-out answer. But, that is an important part for my patients that, when the grain-free diets were really popular, I had a lot more GI problems. And part of it was initially the grain-free didn't include enough fiber. So there's a lot of things there that have been evolutionary for my practice over the last 30 plus years. So that is a really good question. And I think that that's a good conversation to have about with your vet. And also, there's some people who have a lot of ethical choices around that too. So there's it's a very good and very challenging to answer question. I will say, I think the dogs that I see that either have a human grade food or fresh food, I've seen some make it to 16, 17 years old. And then, then I have a lot of guilt about what I feed my dogs, but that's a whole nother level. So I think it's worth a conversation either with a nutritionalist if you want to make that investment, or your veterinarian based on your pet's history. And this will be one of my favorite questions to hear your answer to. What do you think about the Purina product Fortiflora?
Well, I think yeah, this is so I think Enterococcus faecium, which is what is included in Fortiflora, can promote the production of beneficial compounds in the gut. And I mean, the interesting thing though is that we find that it's almost all healthy cats and dogs have it. So I don't know if you need to supplement with it. Certainly not if they're healthy. The strain that's in Fortiflora is a human strain, but it was found to be beneficial for people. And I think that Purina was really, I mean, like pioneering in bringing this product to the veterinary community. And I think it has some kind of hydrolyzed animal protein in it, which, you know, if you're concerned with sourcing, is like not really clear what that's coming from, but it does make it palatable. So, you know, because you have to balance that, I think. So I think it's a useful tool. I think though, if your dog had to take antibiotics, and you give Fortiflora afterwards, I mean, like it can help support gut function, but it may actually delay recovery. And it's basically not the same thing as like a fecal transplant where the gut anaerobes that are so important for gut health are trying to be reintroduced. So I think it's a useful tool. And people have said, and I've seen this, that it can help with diarrhea. Like, personally, I tend to prefer Aspergillosis because we've done an extensive research and found that it doesn't compete with the native gut bacteria in cats and dogs. And so that's sort of more of my go-to.
Yeah, and I've certainly developed the same habit. I basically tell people probiotics are us guessing at what bacteria the gut needs. And if we guess wrong, we may not be really supporting the bacteria. So the Aspergillosis, which is a yeast probiotic, it is kind of my go-to as well now, because it's here's the tools for your gut to restore itself to the best of its ability.
Yeah, and it's not competing with the gut bacteria. So
yeah,
the more I learn about Aspergillosis, the more I'm a fan. Like it helps to coat the gut lining and reduce inflammation, and that can allow like the good bacteria to get back in there.
Yeah. And this is a good next question. Is microbiome testing expensive, and are many vets in our area offering this testing? So this is a great one for you because.
Yeah, I mean, I think, well, it depends on your budget. I guess I think we make it very affordable, and you know, when I look at what I'm like, so we do extensive testing of our donors for our FMT capsules, and what I pay more for parasite and pathogen testing with IDEXX than what we charge for our microbiome testing. And what we're doing actually is a lot more involved. But we sell our microbiome testing for $125. And then you can talk about those results, or you can also just get it through your veterinarian. That's the preferred route. Like then your veterinarian can do a consult with you and really help guide the treatment plan. And I think that's a really critical investment. Sorry, my dog's opening the door. He's like, it's time. No, it's not time. I think it's worth the investment because the gut is so foundational to health. And if things aren't working, it kind of can give you point in some directions. So maybe like, oh, maybe a little more fiber, or, you know, like this one with oral I do also do oral microbiome testing. And for him, like we had this water additive that we added, and I needed to do double the amount with him just because maybe he doesn't drink as much water. So I'd love to know what you think, Dr. Birch.
Well, I think I have a dog who had really bad, a patient, really bad E. coli when we microbiome tested her, and we actually ended up doing an oral microbiome test and found out the E. coli that was really prevalent, like in the 60% of her microbiome. And when we fecal transplanted her with the capsules, her clinical signs of IBD resolved. And this was a dog that had all the steps up to endoscopy, but the endoscopy was a little daunting for the owners. And we've been following her. Actually, it's coming on 2 years. And each time her E. coli is coming down every time we test. But getting her teeth clean was huge because this repopulation of E. coli that was residing in her mouth actually was playing a role in her disease. So we still have to FMT transplant her probably twice a year to keep that at bay. But it's been lovely to see how therapeutic that is. And it's a pretty high-strung dog, so I'm not anxious to do things like steroids. That is a traditional treatment for presumed inflammatory bowel disease. So
yes, I have a border collie mix that I just had to put on steroids, and it was a nightmare. I mean, he threw his back out, so there was sort of, in the end, it was the only thing that worked, but he was like demanding things of us all the time. He didn't know what to do with himself on steroids. Yes.
Yeah.
I mean, so was it when I started doing the oral microbiome testing, I was really surprised to see that, especially with these GI cases, elevated levels of E. coli in the mouth. Like that's actually something that I'm looking forward to publishing, because it's really not well known that that would be an issue. But the E. coli can colonize the mouth, it can colonize the throat, right, the esophagus. And yeah, and it's good to know about that, because there are some tools of things you can do to try and bring those levels down.
Yeah. Yeah. And so there's two other questions right now that I can see. And one, we did the microbiome testing, so kind of in that 125, 150 range, which is really, like you said, quite affordable compared to some of the diagnostics out there. The next question, and I'm not sure we can answer this, but well, I can answer this part. Can a raw food diet help eliminate Giardia in dogs? I'm going to say I'm not confident that a pathogen, Giardia is a protozoal parasite. I wouldn't count on a raw diet to resolve that. You should medicate there are different medications we can use, metronidazole one of them, but also Panicure, which is a anti-parasitic, which I tend to use first, just with my goal to keep the microbiome as pristine as possible in my patients. And then the next question from the same person is, are there any healthy kibbles, which I think you touched on a little bit with ingredients.
Yeah, I think there are some brands that have good quality ingredients in their kibbles.
Yeah. And then and I tend to say, read the ingredients and make sure that you're comfortable with them. And of course, with my patients, either we're, hoping to switch to chicken, or, if I'm a single ingredient person, I probably do a little more diet modification, mostly looking for food allergies to certain proteins, but also fiber and this S. boulardii, which is our next question. Can we spell the Fortiflora alternative? So I will type that in the Q&A.
Yes, I like to call it S-boo because it's really hard for people to.
Yeah. Well, and I don't know if you want to touch on, it is a product that AnimalBiome has.
Right.
So if you want to talk a little bit about your GI relief, that would be a good time for you. Now it would be a good time to do that.
That's right. Yeah. So we have a couple products. We have S. boulardii with FOS, which is a beneficial prebiotic, and I like to keep it on the shelf. And if there's any, if my dog has diarrhea, I just give them a little bit that right away, and then it always resolves. And then we also have Gut Maintenance Plus, which is the S. boulardii, also is with some little bacterial viruses that target elevated levels of E. coli. And then also has some prebiotics. And so and that's sort of more of a maintenance dose, like if they need it every day. So there's a couple options there, and big fans of those. They're like my go-tos just to keep my pets healthy.
And I think that is something I usually recommend when dogs go on antibiotics, as a prophylactic, especially for a GI tract that we know is going to be sensitive.
That's right.
And there's a question here, Darlene, I'm going to answer your question so that Dr. Ganz doesn't have to do the veterinary stuff. And the question is, I often hear about food allergies in cats and that you have to try cutting out food A and only give food B. Could this be the same or related to what you're talking about? So yes and no. Yes, in that we do think that inflammatory bowel disease can be a sensitive. Inflammatory bowel disease is an umbrella statement for the guts are inflamed. So vomiting, diarrhea, weight loss, appetite changes are all the things I look for those signs. Some cats do have allergies to chicken or a specific protein. So you can either do what's called hydrolyzed protein, where you break the protein into short amino acids, or you can do a novel protein. And I usually ask people to do what's called an LID, or limited ingredient diet, where there's a single protein and a single carbohydrate. And so we'll try those diets. And yes, you could do a process of elimination. I think in those cases, if you're willing to do a microbiome test, then a lot of times you may find that the microbiome's imbalanced and start with that as opposed to diet changes. And there is a kitty actually that I did endoscopy on whose biopsies came back and I thought, this doesn't really fit with the diarrhea. And he did have a very disrupted microbiome and is doing great after the fecal transplants, although those FMT capsules, which are capsules of fecal transplant, are really challenging to give because you can't really break them out open. You got to get them in whole. And so some of my cat patients, we end up doing a procedure where we transplant the gut other ways, coming up from the other end, I'd say. So.
Yeah, those kitties can be challenging.
Yeah, and yet same thing. I had one kitty that was a patient that was really, kind of mom was at her wit's end, and it was really challenging. And we started with a fecal transplant, and then she managed to get enough of the FMT capsules to solve the problem. And that was a kitty that she had adopted probably, I think, at 6 months, and it had diarrhea for almost 2 years. So a very happy ending for that family.
Great. And for some of the cats, they can try like syringing it with some like wet food. I mean, the cats won't love the taste of that FMT powder, but things like Hiranonis are actually acid tolerant, so they can go through the stomach without being killed.
Okay, good to know.
Yeah, really
so yeah, I think that answered all the questions in the Q&A. So thank you, everyone. Thank you so much, Dr. Ganz. Lovely. So much to talk about. It's like I'm sure people do have seminars that are days long about this kind of stuff, but that was a very nice overview for people just really trying to be advocates for their pets.
Thank you so much.
So keep up the good work, and I'm sure maybe you'll get a lot of people interested in this, and certainly to answer some of the questions, this is something I do quite often in my practice, and I think most veterinarians are starting to include this type of thing in their evaluations. So thank you, everyone. We really appreciate you being an advocate for your pet and supporting BirchBark. So have a great evening, and thank you again.
Thank you, guys. Bye.
Bye.